If you suffer from jaw tension or clicking or headaches resulting from that tension, there are things you can do at home. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and in our practice, we treat jaw pain. You might be interested in our video, How Chiropractic Can Help Jaw Pain. But today, I'm going to talk about things that you can do at home. First, let's talk about some habits. So if you're chewing gum, that's like exercising the muscles of the jaw all day. So let's try and give those muscles a rest and stop chewing gum. If you happen to sleep on your side, sometimes that can put pressure on the jaw, cause it to get out of alignment. So maybe try to sleep on your back, or at least try to switch sides. Try to pay attention. Are you chewing only on one side or really preferring one side? Try to even that out. And notice throughout the day whether or not you are clenching. Sometimes this is a subconscious habit that we're not even aware of. So try to bring that awareness there, and then you can mentally relax your jaw. It's always a good idea to check in with your dentist. They might notice if there's some grinding in your teeth, and they can prescribe a mouth guard specially fitted for you, which is going to protect your teeth, might even alleviate some of that jaw tension and pain. But let's talk about other things that you can actually do. So self-massage is one technique that I really recommend. And we're going to work on three muscles. The masseter muscle, which attaches from the jaw joint itself down into our chin. Then the temporalis, which attaches from the jaw up into the skull. And then deep inside, there are pterygoid muscles that attach right around the jaw itself. So first, let's talk about the masseter muscle. So I like to use my two knuckles to massage that. So you can either provide a little bit of pressure like that and do little circles, or you can put that pressure down from the jaw, and then you're going to open and close, moving along the line of the muscle. Now, I'm doing it on both sides, as you can see, because if you have that misalignment, it's good to put equal pressure on the sides of the jaw. If you're just doing the circles, you can do one side at a time. So that's the masseter muscle. Then the temporalis muscle. So you can actually imagine if you put the heel of your hand at your jaw and fan your hand up, it's a big muscle that goes up into your skull. For this, I like to use my fingertips. Again, you can make circles going up into the skull, into the hair. You might be surprised how high up you actually find tension. Or you can, again, push away as you open and close, moving up the line of the muscle. That's similar to the active release technique that I would do and work on you in our clinic. Now, the last one is working inside the mouth. So if we're going to work on the right side jaw, I'm going to use my left hand. I'm going to put my thumb down. So pinky's up. It's going to slide along the inside of the mouth, and then you're going to open a little bit so it can go a little deeper. And you're just going to do a little bit of rolling with the pinky, finding different spots, pressing outwards on the cheek. So I'm taking my hand, just like that. Now, you might find that you're feeling a little tender after this, but you also might find that you have a release of that tension that you might not have even known you were carrying around. Of course, if this doesn't alleviate your jaw pain, or you'd like some extra assistance with it, or someone to take a look at it and figure out what's going on, you can book online with us at willowbrookchiropractic.com. If you have any questions about what I talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.